Welcome, everyone. My name is Rebecca Trout, and I'm the Program Director here at the National Civic League for the All-America City Awards. I want to welcome you to today's workshop, Lessons on Resilience and Equity from the COVID-19 Epidemic. Today we'll hear from city officials about their pandemic response, and they'll have a particular focus on how their civic capital and focus on equity mitigated the racial, ethnic, and socioeconomic disparities of the outbreak. We're going to hear from Derek Okubo, Executive Director of the Agency for Human Rights and Community Partnerships for the City of Denver. We will next hear from Stacy Schweikart, Director of Strategy and Engagement for the Miami Valley Regional Planning Commission. And last but certainly not least, we'll hear from David Rubidor, Director of Neighborhood Community Relations for the City of Minneapolis. Derek, without further ado, the floor is yours.
Okay, very good. Thank you. And welcome everyone to this workshop. I'm real honored to be a part of this interesting approach this year to All America Cities. Over the years, I had been employed with the National Civic League, left there as the senior VP, and then for the last few years I'd been the foreperson of the All America City jury, and I'm currently on the board for the National Civic League. So National Civic League is a part of my DNA, but I'm going to just talk a little bit about the lessons that we learned from the COVID pandemic here in Denver. One of the things that I that I lost in the transition was a slide on our equity tool kit, but I will go over that as a part of the presentation. So just real quickly, as far as the my agency, we were started in 1947 by a very progressive mayor who came on the heels. He beat the incumbent of the Denver mayor, previous mayor, who had a kind of a infamous history as far as his affiliation with the Ku Klux Klan. And so this mayor, Quig Newton, who came in and defeated him, his platform was on race. And in 1947, he started our agency and commissioned them to do a study of race relations in Denver. And so as a result of the evolution over the 70 plus years, we now have 9 different offices that focus a lot on our vulnerable communities, whether it's people living with disabilities, older adults, immigrants, and refugees. We have our anti-discrimination office, nonprofit partnership office, etc. in our agency, plus the 10 advisory commissions to the mayor that advise myself and the mayor on issues related to the constituency groups that they represent. But just as far as jumping right to some of the internal lessons that we had in the city, over the last 7 years, we in the city had been doing some very extensive training in our emergency operations center. In this operations center, we would, it was focusing on save the city. That was the premise and the motto of the EOC. And we had every year, 3 times a year at a minimum, we would have a scenario training. And in all honesty, it was kind of a pain, you know, for us to give up a full day of training. And we focused on scenarios that included tornadoes and chemical spills, terrorist attacks, cyber attacks. And while it was a pain to give up those days, it was really proved to be a godsend in the long run. We had only 2 activations over those 2 years, and they were only for 1 day, 2 days at the most. And one was a severe snowstorm, and another was a pretty intense fire that we had in the city. And so we were fully activated just for 2 days at the most. And then this pandemic came along, and we were fully activated for 88 straight days. And so it while a pandemic was one of those areas that we had discussed, we never thought it was going to happen, in our lifetimes. And then here, all of a sudden, in late February, we were fully activated and proceeded to be so for the next 88 days. We are now partially activated, where we are tracking on a daily basis the situation with our COVID here in Denver. But as far as full activation, we ended that in early July. But the keys to the lessons within our city government was that, the decisiveness of our city leadership was absolutely essential. We had a mayor when we first started meeting about COVID and the outbreaks in early February. And then even he initiated a stay-at-home order even 1 week before our governor initiated a statewide order, because we saw the trends and the data pointing to a direction that we had to jump on and intervene right away. And so the mayor, who listened to our public health director, our emergency management team, very decisively activated the EOC, the Emergency Operations Center, and the initiatives that we had to have in place, the stay-at-home orders. I had mentioned the EOC training ahead of time. That was absolutely essential as far as planting in our heads a mindset as far as how we needed to approach the coronavirus and the outbreaks. The collaboration, through the training, we had very clear roles and responsibilities as far as what we were tasked to do. I was the branch director for the liaison section, which worked a lot with the community, with our community partners, whether it was our businesses, our nonprofits, our faith community, the private sector as far as businesses and grocers. But this section that we were in touch with was, just through the course of the training and the practices, it was very important as far as information gathering and information sharing, and then implementing strategies that we had to have in place in order to address whether it was food or sheltering and transportation of supplies and things like that. But that was absolutely essential as far as the training was concerned, so that when we were activated, we knew what to do. Our city departments that we have, the collaboration and the breaking down the silos had been going on for a number of years, but COVID forced us to bump everything to a level that we hadn't been at ever before. And that was one of the things that was positive that came from it, was a forced collaboration and sharing of resources. I mean, when we talk about collaboration, sharing of resources and partnering on a broader mission and good. And so that's what we're forced us to do. The next one, as far as, external community. The Agency for Human Rights and Community Partnerships, one of the things that we are the city's community contact agency. And so the relationships and the partnerships that we had ahead of time were absolutely essential, because we had to move at a fast pace. Oftentimes we had to know who the key contacts were. Oftentimes, with especially our communities that did not speak English as a first language, we had to know which languages and which neighborhoods were prominent. We had to get all the materials translated into those languages and get them out through our key contacts. A number of our key contacts were very important as far as getting word out. For instance, in our Vietnamese community, Um, we have a few leaders that would have Facebook Live sessions with the community, where there was quite a few that participated, and it was spoken in the native language. And so we were able to get out very important and crucial information as far as resources and what the orders were, and also key contacts on a regular basis. Let's see, I just saw that thing pop up. Can people hear me okay? Okay, I'll take that as a yes.
You're kind of broken up, Derek. I don't know if you can move or not, but your voice is coming and going.
Okay, well then I'll move more forwards to the screen. Be scary for people, but I'll do that. But the pre-existing, can you hear me better now?
Yes.
Okay.
Yes, I actually think it's more of a connection issue, Derek, than it is a volume issue. I'm noticing it's when you move around a little bit more, I think your connection gets a little spotty.
Okay, I'll try not to move. Okay.
Thanks.
So, but what I was saying is that the pre-existing partnerships that were in place were absolutely essential in order to get the information out and to get information in. A lot of our approaches that we needed to take came from the community itself, and as far as where needs were brought up and directed to us, and we were able to respond. And oftentimes it was through our nonprofit partnerships where the service delivery occurred. It wasn't from the city. It was through our nonprofit and service provider contacts that we were able to do that. One of the things with the new opportunities occurred, for instance, like with our food, the grocers, whether it was Kroger or Walmart or Target. These stores were absolutely essential. We would have weekly meetings with them as far as where they could bring up issues and concerns, whether it was PPE or whether it was certain things that needed to be in place. That was something that we heard from the community, and it was through those types of new relationships that we developed that continue to this day as far as service delivery and getting information out, getting information in. One of the things that with our recovery, we started our economic recovery focus probably back in May, when we started to initially look at reopening in the community. One of the things that our economic recovery has been entirely driven by the community, whether it's restaurants, larger businesses, small businesses, our nonprofit sector. We have formed what we call the Economic Recovery and Relief Committee, which is made up of over 200 different non-governmental individuals who have participated and developed our recovery plan economically. We were meeting weekly. There's probably, let's see, I think there's 6 different subcommittees that have worked with us. And they were the ones that really gave us all the input as far as all the recommendations that needed to be in place for recovery. And they were the ones that told us what we needed to do in order to help clear the way so that they could recover. For instance, like our restaurants were telling us as far as open patios and closing streets so that they could put tables out into the streets for their restaurants. Some of the other needs that some of our small businesses were requesting as far as PPE and other ordinance changes that we needed to put in place. But they were the ones that told us what they needed and what we needed to do to help them in order to reopen effectively. Where things stand right now, with Denver is that when we did start to reopen, we did see the numbers start to climb again as far as the positive test rate, which was initially around 2.5 to 3%. We started to get really worried when we started to see it climb towards 7%. Through the course of instituting the statewide mandatory mask order, and then also some other enforcement that we had to do with bars and restaurants, 10 p.m. Let's see, when you last call at 10 p.m. We were able to see the numbers start to decline again. So the cause and effect, we're now back down to about 2.5% positive rate. So we rather than pull back the variances, we were able to keep them in place. So much of it was dependent on the people complying with those orders. Anything that we did as far as a task from the Emergency Operations Center, every task had to go through an equity check. One of the things that we have been doing in the city is making sure that anything that we do with the community, every department is required to do this, must go through an equity check and looking at things through an equity lens. And so this was no different with any task that we did within the Emergency Operations Center. And there were 4 questions that every task had to go through in order to be actually implemented. And first it focused on, does the task benefit or impact any of the following populations? And we had older adults, people with disabilities, individuals with chronic medical conditions, and historically marginalized communities and under-resourced communities. The next question really focused a lot on, does the task benefit the identified community, and are there unintended consequences for the planned strategies? And if there were unintended consequences that emerged, then what were the mitigations in order to address that and to mitigate those consequences? What we found in any time we did this, I'll use one example, was when we were looking at staffing. We needed staffing at new shelters for our residents that were experiencing homelessness, where we were seeing some outbreaks of COVID. What we found through the course of doing this was that we could not assign underinsured staff or partners to be the staff, put them in a vulnerable situation where they could get infected and then have the medical consequences as far as the costs and everything. So what this equity checklist spotted was this inequity. And so we intervened and made sure that those that were staffed were city staff that were fully insured. And as a result, we weren't putting people in a potential harmful situation long-term financially and health-wise as well. So with that, I'm going to stop there and let David take over next.
Thank you so much, Derek. And I believe we're actually going to switch over to Stacy. And Stacy, I'm going to stop sharing so that you can share yours directly. And Stacy, you are muted.
Hi, thanks for having me to talk about the work that we're doing here in the Miami Valley. I work for the Miami Valley Regional Planning Commission. We are the Metropolitan Planning Organization and the Council of Governments for the Dayton, Ohio area. Slides are not, there it is. So here's a map of the southwest area of Ohio. These are the counties that we cover, just to sort of geographically orient you to where I'm sharing some information. The other thing that I want to relay is that I think that this is a little bit important, that we have had a nexus of 2 disasters, well, arguably 3, but 2 nationally declared disasters in our area in the last year. Obviously COVID, which everybody is dealing with. Memorial Day of 2019, we had 15 tornadoes ranging from EF2 to EF4 touchdown all across our region. The tornadoes went like this, right across our counties. And when I show you these maps, that's going to be important, particularly as I talk about equity and some of the things that we've done as a result of COVID. So where does our region stand on equity? We are 14th out of 102 metro regions on racial segregation. You don't want to be high on this list. I'm going to show you some maps in a minute. A lot of my presentation is data and maps, but I'm going to give you a really concrete example of something that came out of our work. We're also 62 out of 150 metro regions on income inequality. Also, we don't want to be at the top of that list. All of this work, by the way, comes from work that our agency did in 2017 in partnership with the Kerwin Institute at Ohio State University. My colleague Martin Kim out of our community planning division led the work to really do some regional profiles in a variety of areas, but equity being an important one to really tell the story of our entire region. What we found, and certainly is the case in a lot of areas, that there are some factors influencing inequity, and though some of them happened decades, if not a century ago, they are still impacting our community, particularly redlining and predatory lending. This is a map from 1937 that showed the areas that were recommended against investments. This is the redlining map, essentially, for Dayton, Ohio. And so you can see the river runs right in the middle of our urban area here. We have redlining areas on either side, declining noted areas that surround it. And so that's sort of a picture from nearly a century ago of our community. This is 1980 aggregate income distribution for the Miami Valley. And as you can see, here are the rivers that go through. This is the urban core of Dayton right here. And what you're seeing is in 1980, a map that is really, really close to the redlining map from the early 1900s. This is 2010. So I'm going to go back and forth a couple of times to show you something. 1980, 30 years later. Here's why we, as a metropolitan planning organization, are very involved and committed to the equity work for our region. Again, 1980, 2010. This byway right here, interstate byway, we helped support its construction. And this is what happened. The wealth moved to the outside of the byway. And certainly there are communities across the country that, you know, could share maps that tell the same story. But what ended up happening is moving out of the urban core. You can see where the wealth moves, and you can see then what is left behind in communities that really have a disproportionate lack of access to opportunity. This information is from 2010. It's an opportunity map. And so opportunity is gauged on housing and neighborhood, transportation, economics and job access, and education. The blue areas show where there's high access to opportunity. The areas that are shaded in an orange or brown color show lower access, and the more dense they are, the lower the access. So again, think about that redlining map. Think about the construction of this byway and the way that the population shifted. Likewise, this is access to opportunity for minorities in our community. This is where census tracts and areas have percentage of minority respondents. And so The largest circles are where the communities reflect minority of greater than 25% of respondents. And so you can see again, clearly there's an equity picture here. Access to opportunities by race. This one, I believe more than anything else, really shows the disparities in our region. This is the percentage of white population who have low or very low access to opportunity as compared to the Black population, and then Hispanic population, of course, is over here. And this also overlays single parent households. And so this is all using the previous census data. So, you know, we plan to do these again to see what things look like in the future, but this is single parent households as well. And then some poverty data. And you can see that the maps, the concentrations make it pretty clear where there are areas of our community that need our investment. I talked a little bit already about what makes a place high in opportunity. So what did the Miami Valley Regional Planning Commission do? I mean, we did this study and all the research in 2017. In 2019, we formed the Institute for Livable and Equitable Communities. Just a side note that I have been with Miami Valley Regional Planning Commission for about a year, just over a year. And I worked for 18 years in local government administration at one of our member suburban communities before coming here, but it was really the opportunity to do work as part of the Institute, as well as help with the tornado recovery work for our region that really drew me to this position, to a more regional leadership. The Institute exists to convene partners from all private and public sectors and to be the central point of coordination for a long-term, multifaceted effort to address livability and equity in communities. We formed the Institute in partnership with the Dayton Foundation, our major philanthropic organization, as well as our county, the city of Dayton, the Dayton business community, a couple of the healthcare institutions, the University of Dayton, Sinclair Community College. So we have higher education, healthcare, transportation, local government, nonprofits, all involved. This is an intentional focus to get everybody at the same table, sharing the same experience, using the same language, all pointing in the same direction. Instead of doing work in our silos in the areas of equity, we are really bringing everybody to the table to work collectively on systems transformation. Our focus is on critical elements, like I said, of transportation, education, housing, public spaces, civic engagement, community support, and public health. And I would note that really the foundation of our model is built off of the World Health Organization's domains for livable communities. And they parallel very well with the social determinants of health that our healthcare partners are using, and a couple of other jargon, education systems and everything that seem to help us find some common ground on terminology. Within the Institute, we have something called the Regional Equity Initiative. As I showed in all of the maps, Miami Valley's success and wealth and opportunity are very uneven, and there's a lot of past policy that shapes what's going on to this day in our region. And so we're all sort of working together to figure out how we can change the landscape. And there's a great deal of community involvement in this, and we don't have time in this presentation to get into that, but it is a really, really critical component of what we're doing. And so inclusion and engagement is a key strategy, working on building partnerships and organizational collaboration, and then policy change and systemic transformation. So I want to share with you now as an example of something that took place as a result of the COVID pandemic that really allowed partners in this institute to come together in a very tangible way to make a difference in our community. I'm sorry, real quick. This is the list of all of the organizations that are involved in our regional equity initiative under the Institute. So you can see really a wide range of community institutions and organizations. And we have parks in there as well. We have a federal court judge who's on it with us. And then community leaders and concerned citizens, I wish was kind of headlined across the top, but okay, so COVID. In Ohio, we use the governor rolled out something called the Public Health Advisory System. So each week we get an update to this. Each county is ranked by the severity of the outbreak in their county. There are various factors that go into that, but this area right here is ours. And this county right here is Montgomery County, and that is the city of Dayton is located in Montgomery County. This is our most urban county. And so Montgomery County, as of last week, was at a red level, level 3, very high exposure and spread. Montgomery County has been at a level 3 since this system was rolled out. So just to tell you what the areas that we're dealing with, this is Cincinnati. This other red area is Cincinnati. This is Columbus. This is Cleveland. Toledo is in here too. But it's mostly urban areas. And I think, you know, Ohio is seeing the same thing that is being seen across the country with the disproportionate impact on already disadvantaged communities. So the project that we ended up taking the lead on was called the Digital Divide or Internet Insecurity Project. Even prior to the pandemic, reliable and affordable high-speed internet access was an issue in Montgomery County. And the pandemic only exposed and widened that digital divide that we knew for a long time was an issue in our communities. I showed you sort of the path that the tornado came across. The tornado path came right across the maps that I showed you where the highest concentrations of redlining occurred in our community. And what we learned in the aftermath of the tornado disaster was that one of the major issues was the lack of ability to have connectivity. Many of the areas were still, their only option is satellite service, and for emergency response, it was a real issue. And so we were already sort of working on it. And then the pandemic came on as our nexus disaster and only exacerbated the issue even more. So Montgomery County residents who don't have secure and affordable internet access, we're not just talking about kids, though this project that I'm going to talk about is about students, but it adversely impacted education, workforce, and healthcare. No access to remote learning, no opportunity to have employment that required working from home. I mean, the individuals were forced out essentially into jobs out in the community that enhanced their exposure. And then telehealth was also not available. So we convened a group that included a wide range of partners in the fields of education, philanthropy, technology, business, the libraries, local governments. We collected data from all the public school districts in our county for the number of students in their school district that did not have affordable or reliable internet access. And then we mapped all of this data and we pulled data on provider availability throughout the region in order to facilitate an analysis of potential solutions. So this is what our map looked like. Each dot indicates a household without reliable and affordable internet access for remote learning. There are about 3,800 students that did not have access. The shaded areas show you the highest concentrations. If I were to draw that river again, it goes right here. And so these were the highest concentrations of students. The pink dots are multifamily public housing. And then the yellow dots that you can see a few of are HUD assisted property. So we mapped those for several reasons, one of which was we were considering an option where perhaps we did Wi-Fi, extended Wi-Fi solutions on some of the multifamily housing units. But we ended up going with a different solution, and I'll tell you about that in just a minute. But this just kind of paints the picture of where the need is. And you know, this community here this is the urban core. You skip 2 suburbs. There's a community here. There's a little bit of need out here, but you know, this whole area sort of, you can see the need. This is a map that we pulled from FCC data. It's a provider map for satellite, DSL, fiber, and cable-based internet service with speeds that are considered reliable for either work or education. And the more shading of the area, the more provider options there are. And the lighter the shading, the fewer options that they are. This is the this is the city of Dayton right here. This is the river right here. This is the path that the tornado took right here. And so this lightly shaded area out here, some of the lightly shaded areas here and here, the only option is satellite. Cell service is even not incredibly reliable. It works, but it's not great. There's only really one provider that is good. So in the near term, we just found out about 2 weeks ago that we secured $1.2 million in funding to provide reliable internet access for students in Montgomery County that don't currently have the access. We have completed the procurement for about 3,800 personal hotspots using a year of unlimited data cellular service with the one provider that does have good coverage across the entire county on all the content filtering and everything that is really, really critical for education. The reason we went with personal hotspots is because they'll travel with the students. And so there was a side-by-side effort that was all private philanthropy to raise the money to buy the Chromebooks or tablets for any students who didn't have one through their school district. So that was happening at the same time. So we have devices and connectivity coming together. The reason we chose personal hotspots is that they will move with the student. Many of these students have more than one household. Many of these students go to another place during the day while their parent or parents or caregivers work. So it allows really the student to be able to move where they need to move and keep up with their schoolwork. It also allows them to learn without having to walk to find transportation or to congregate in common areas for shared access. Longer term, we were already working on a strategy as a result of the disaster recovery efforts from the tornado to look at investment in fiber and broadband networks throughout the region. And this only kind of elevated and sped up those applications. In fact, the county is now looking at a countywide solution, a countywide application to the Department of Commerce out of the disaster recovery funds. So we are looking at securing that funding for a broadband expansion for the entire area. The reason I think that this is really important, and certainly this is a tangible project that came up because of COVID, but this is the map I showed you with provider availability. And this is the 1937 redlining map. And you could sit them right on top of each other. And so in our region, and really everywhere in the country, this is an equity issue. And it's why we're really, really focused. Typically, we are known for doing transportation infrastructure, but there are other forms of infrastructure that are really, really critical to creating equity in a community. And so this is the work that we are doing.
Thank you so much for that, Stacey. Love how you've been able to sort of take things that have come up in multiple sort of crises and come up with a solution that's going to benefit both. I'm now going to turn things over to David Rubidor from Minneapolis. David, the floor is yours.
All right, thank you. Thank you, Rebecca and Derek and Stacey. It's great to hear a lot about what you were working on there. As I talk about what we're doing here in the city of Minneapolis, there's a lot of similarities, and I'll try to kind of move through the similarities fairly quickly. What I'd like to do, oops, sorry, my phone starts ringing. What I'd like to do is to give you a little bit of an overview of what we did in the city in order to respond to COVID, and then dive a little bit more specifically into one particular tactic, which we found really useful, really from an engagement standpoint and how we were working with the community. So really kind of taking it from that standpoint. The one thing I want to mention too is Stacey mentioned that their area is dealing with two crises or two emergencies at the same time. Minneapolis is in the same situation, just a different type of emergency. COVID obviously is one of the emergencies we have going on right now, but also with the killing of George Floyd and the civil unrest that hit our city after that, compounded a lot of the work that we were doing around COVID. And I'll try to touch on that a little bit at the end, albeit that's kind of emerging. So again, I'll go over a little bit of the overall structure about what we're doing, and then I'll go into a very specific tactic. The question here is, lessons learned or lessons of resilience. I'm gonna do the shared screen here. So, can everybody see my screen?
We can, thank you.
All right, great. So, So one of the things I'm going to kind of share right at the beginning, to me, the lessons learned in this work, and I hear the same thing when both Derek and Stacy are talking, that the time to build the infrastructure and the time to address the work is not during the middle of a crisis. That it really does take, the cities need to be prepared and governments need to be prepared in advance to be able to deal with issues as they come forward. And so Minneapolis is also very similar in that respect, and I'll touch base on that. But the idea around dealing with equity really has to be a long-term commitment, and one that each of the levels of government are addressing before situations like COVID hit, which have a disproportionate effect on equity within our communities. And so that's a big piece. The other kind of big lesson I think learned as we do this work is to expect the unexpected, in that things are going to come up that even with the best of planning that you just aren't ready to or prepared to deal with. And so as a result of that, you just have to be really nimble and agile as you're moving forward. So the structures are great, but you also have to be ready for adjusting along the way. So with that, the city of Minneapolis has had a strong focus on equity for a period of quite a few years now. We have an Office of Race and Equity that was put into place a number of years ago, and the city has a strategic racial equity action plan, which is in essence the guide for the city about how each department is responsible for addressing equity in the work that they're doing. And similar to the other two situations that, and I think Derek was talking about it specifically, as departments do their work, there needs to be forethought about what the racial equity impact is of their work. And that needs to be brought into consideration as they're developing programming and/or policies moving forward. The department that I lead is called the Neighborhood and Community Relations Department, and it's been around for about 10 years. It kind of predates the equity work that was what we formerly call equity work, but it is actually very much geared to that type of work. The Neighborhood and Community Relations Department is the city's community engagement wing. In essence, we're the ones that really try to help other departments reach all segments of the community in the work that they're doing. And that has a very, very specific racial equity component. Part of the structure of our department is that I have staff that are embedded into the African American, Southeast Asian, Latino, East African, American Indian communities, people with disabilities, seniors, and the LGBTQI communities as well. So these are folks that their job is to be out in the community on a day-to-day basis, building relationships, understanding issues that are there, understanding communication concerns, establishing long-term relationships, basically knowing the lay of the land within each of these communities, and then helping city departments better understand how to work with each of these communities. In addition to that, the city has 70 different neighborhood organizations that are geographically based organizations that cover the entire city. And I have staff that work with that group as well. The Office of Immigrant and Refugee Affairs, similar to I think what Denver was talking about, is also located in the Neighborhood and Community Relations Department as well. Trying to move the slides forward, sorry. So is also located within the Neighborhood and Community Relations Department. And so it's kind of a broad array of services and a broad array of engagement tactics in order to really build relationships, long-term relationships with community in many different ways, particularly focusing in on folks that have typically been left out of the decision-making process or have not had equitable access to resources in the city. And so just an entire department focused in on that. A lot of our work is around communications. We work very closely with our communications department and how we communicate and what kind of messages need to go out into community, as well as when we hear issues that are there, what types of ways that the city needs to interact with different communities is included. I put on here radio programs, which I think is kind of unique for a city municipality, in that our department actually has 4 different radio programs that we do on an ongoing basis. These radio programs are in Spanish, Hmong, Somali, and then we have one for the African American community as well. And then we also have the ADA Title II accessibility and compliance work located within the department. So basically a broad array of services, a broad array of different ways of engaging community that pre-existed COVID and that was ready and available when COVID hit. One point that Derek mentioned as well is one of the benefits of being the last speaker. You get to kind of tie onto what other people were saying along the way, that their model is that they really work with nonprofit partnerships in order to, that's really where the service is and that's really where the engagement occurs. Very similar to Minneapolis as well. We do engagement to some degree directly with residents, but to a large degree, a lot of our work is focused in on building relationships with trusted community partners and having the partners actually doing work with the city to engage residents or to engage different members of their community. They're the trusted partners with community, and that really creates a nice partnership with government to be able to have that kind of intermediary and that type of relationship that's there. So that's very much in place. So when COVID hit, a couple things that happened. We had a lot of these, the department itself had a lot of these services and these relationships already there. We also have a very strong health department within the city, and given the nature of COVID, the health department took the lead in putting together the internal infrastructure to lead the city's response. They set up what was called the, it's actually supposed to be the incident management team, sorry, got that backwards. So it's incident management team, which really led and directed a lot of the work that was going out from the city, everything from mass distribution, testing locations, all that kind of stuff. They're the ones that really led the logistics of the response. There was also the Shared Powered Advisory Committee that was set up, which is a community-based committee that had a lot of community leaders on there that really looked at ways to guide the city in mitigation efforts for the most impacted communities in the city. And so this is really that community, formal community-city partnership that was put into place. And then we also had what was called the Joint Information System put into place, which was a variety of different departments, including NCR, my department, as well as the health department, as well as our development department, really being at the table so when we were developing messaging that was going out to the community, or we were developing information around COVID and safety protocols, that was actually being sent out, one, in a unified way, but then also in a culturally specific way. And I'll talk about that as I get into the very specific example I want to talk about. So we had staff, NCR had staff in all these particular levels of the city response, very community centric. Our health department is also very community centric. And so really trying to build these partnerships between the community and the city to really understand how this was impacting people, what type of messaging was missing, what type of issues were actually out there in order to, that we would need to address in order to really help mitigate the impact within the different communities. I did put in a couple examples in addition to the community dialogues, which is the one I'm going to spend more time on in a second. We did increase our radio shows. They were occurring anywhere from twice a month to monthly. We increased them to weekly and made them very specific around COVID response and COVID information. Translation and interpreting services, which my department actually leads or supports in the city, was really ramped up in a lot of different ways to really increase the city's reach into the non-English speaking communities. And then the mask and food distribution work was going on. And so there's just a lot of efforts around the city, as well as within the department, to really making sure that we got masks out to people and that we were addressing food, the food inequities that were resulting as a matter of COVID or from COVID as quickly as possible. So what I really wanted to talk about was community dialogues. So this is I'm going to spend a little bit more time on this and dive into this a little bit more deeply. This is a very specific tactic that we did that I think brought together probably the best aspects of the department and the way that we do work. We like to meet community where it's at, and we like to have community lead the conversation so that we can, so people are more comfortable. It can be in a format and language that people prefer, and we can learn from those experiences so that we can be better informed. And the community dialogues were really intended to do that. These were normally, we would be going out and meeting with people at some particular location that they choose and what have you. But these had to be done virtually, obviously, for obvious reasons. And so we held these virtual meetings that were lined up between community members, policymakers, and city staff, really with the intent of getting out good information to the community and then understanding what specific and what kind of unique issues are existing within the various communities within our city. So with that, we held community dialogues for the African American community, the East African community, American Indian, Latino, Southeast Asian, seniors, and the LGBTQIA communities. That was specifically for members of those communities. These were open to the public, but they were more, I would call them curated invites. So they were open to the public and anybody could join, but we also were really specific about inviting a lot of our partners to the table to making sure that they were there and that they could partake in these as well. And so we held a total of 16 of these over a couple months. We had anywhere from, on the low end, probably 15 attendees to more commonly about 40 to 50 people, and some of them were actually higher than 50 people participating. We had community leaders on there. We had community organization representatives on there. The mayor would come to most of these. The ones that he wasn't at, a representative from his office would be there. Council members frequently attended. In fact, I think we had council members at every single one of them. And in some cases, we had quite a few council members. We had city staff there. Health department was there. Race and equity, our division of race and equity was there. Our staff was there. And then again, a lot of community members. The format that we set this up in was to first provide the most current up-to-date information on COVID. What was going on? What were the numbers? How was it impacting the city? What were the latest regulations coming down, the stay-at-home orders, the city's mask requirements, what have you, so we could convey out and inform the public and inform each of the communities that we're working with what was the most current information. And then the second half of it was listening and just really hearing back from people about what was going on in their community, what was missing, what was working, what could we be doing differently to respond differently to address some very specific issues there. To a large extent, we heard a lot of what we heard in the mainstream community, which, around protective gear, the need for sanitary stations, housing security, and what have you. But we also heard a lot of stuff that was very culturally specific and very much needed. And I wanted to kind of highlight some of those, if I could, just to give you an idea of some of the information that we're getting back, and then what we as a city could do to respond back to that and respond back directly to those community needs. So for the Southeast Asian community, one of the big issues was funerals. The Hmong community actually has very large funerals. They're very extended families. They usually go on for days. It's a very culturally significant event when somebody dies in a family and people come together. And obviously COVID put a big, put all of them at risk in a very significant way. So we worked with the state of Minnesota to really come up with some good guidelines, some guidelines around holding Hmong funerals in order to make them more safer. You can't always say safe, but safer. And then also use our networks and our partnerships to help get that information out to the Hmong community about changing their practices during COVID around the funerals. And I think to a large degree, that's been pretty successful. We also were hearing from the Hmong community around hate crimes. They were getting targeted. As many of you probably know, there are groups in our country that have basically been blaming China for COVID, and that was being reflected on some of our Asian businesses and our Asian residents in our city. And so the city responded through our communication networks a number of ways around anti-discrimination messages, the need to, that everybody's welcome in our city, reinforcing to the Southeast Asian community in particular, they're welcome here, we want them here, and we will protect them here. Police department was aware of this. The mayor's office, the mayor himself actually issued statements around this in order to really address that particular type of concern. In our African-American community, we were still seeing and hearing about groups of youth, primarily youth, getting together in the parks and not really adhering to social distancing as well as wearing face masks, which led to initially some of the city staff were going out there trying to address that, but then our parks department stepped in, and they have an ambassador program that would go out and actually meet with the youth that were gathering in the parks to really talk about COVID protocols and safety and help to educate people around the notion of that. We try to really avoid moving in any type of punitive way, but trying to be much more proactive and taking the educational approach for community residents. Our East African community, which we have a very robust East African community here, and many of them, there's many small businesses that obviously were negatively affected. Concerns around business survival, which I'll talk about in a minute as well. Our senior community and people with disabilities, as well as the LGBTQIA community, really had issues around people with disabilities and just being able to physically access either resources and or information that was coming out, which again helped guide our response about how resources and stuff were being delivered. And then finally, I was just going to mention, well, actually two more, the American Indian community. We were hearing that hand washing stations were needed, and particularly in strategic locations around the city, portable restrooms, and then also concern around law enforcement and how they were addressing the homeless population in the city, all of which led to being more strategic about where we were putting those resources, and then also working more closely with law enforcement about how to address the homeless population. And so that was also very helpful. The last one I was going to mention is the Latino community, the Latinx community. Obviously concerns around immigration status, access to financial resources, or access to resources for people that were undocumented, and really being able to make sure that people did know that they could access the city resources without fear of immigration concerns. I will say that was a big issue for the Latino community that really kind of, I think, drove people away from getting resources, was fear that with the government, that the government would use this as an excuse or a way to catch people that were undocumented. In the city of Minneapolis, we don't do that, and we made it very clear through our communication networks and stuff that was not the case. And so, so I think on that level, it was really successful. So in closing, I just wanted to touch base on the impact of this work. And again, these community dialogues were really intended on building that one-on-one conversation, or that group conversation, I should say, with community members to hear from community specifically about issues that they were experiencing, and then being able to adjust our infrastructure and our resource delivery to really meet those needs and be able to address them as best as possible. We weren't able to address everything, but I think we were able to address quite a few. And you can see on this list here where a lot of that landed. But it really helped the city with decision-making and our response. I think to a large degree, it really helped cement and help support our ongoing relationships with a lot of these community organizations and community members, and being able to build a better relationship with the city. A lot of targeted messaging and communication efforts to address specific issues within each of the communities I was there. Then also at the very bottom, I put down rental assistance and small business assistance. And although that did not directly come out of the community dialogues, the program guidelines that were developed from that, or for those programs, where we were providing assistance for housing assistance and small business assistance, were informed by what was coming out of the community dialogues. Now, at the beginning, I mentioned that we were dealing with two crises here in the city at the same time. The second one is the George Floyd killing. We held 16 of these community dialogues in April and May. It was our intent to continue to do community dialogues at least for the next few months. When the George Floyd killing happened, it was a significant reset about what was happening in our city. We had a lot of civil unrest. We are still dealing with a lot of crime and safety issues. We are still dealing with how we are going to address community policing and community safety moving forward in our city. And so at that time, partly because of capacity, but also partly because of shifting community priorities. A lot of our work now has shifted more into that community policing realm, but the health department and my department are still working very closely together to making sure that we are being responsive to community needs around COVID, mass distributions, and getting information out. I just wanted to say that because here locally, both of these together are just a massive undertaking for our city to try to address. So with that, I'm going to stop, hand it back to Rebecca, and see if anybody has any questions. So thank you.
Thank you so much, David. I appreciate what you said about the time to think about these things is not in the middle of a crisis, but beforehand. And it seems like you guys had done a lot of the legwork, similarly to the folks in the Dayton area and Denver area, and that's what has made a lot of your efforts so successful. I do want to open it up to some questions. Everyone can feel free to insert any questions into the chat. We are also a small group, so I'm going to make the rare decision to allow everybody to unmute themselves so we can have more of a conversation with those on the line. And then I know you and Derek and Stacy might have a lot to just share amongst yourselves. So I want to open it up to a pretty informal question and dialogue. Do have one question here in the chat box. Someone says, I'm curious about outreach to older adults and people with disabilities regarding COVID.
Yeah, I'll start off and then allow the other folks. Yeah, the accessibility was a huge issue in the Emergency Operations Center and everything that we did when we're talking about sheltering and any type of facility that we opened up. It had to go through an accessibility check. One of the teams that we had within the EOC were from my agency, and they are all in the disability rights office and focused on ADA compliance. As far as older adults, that was key. I mean, as far as some of the most serious outbreaks that we had were in our long-term facilities among older adults, and like nationally, a lot of our folks that perished due to COVID, 75% of ours in Denver were 60 years and older, and very vulnerable. But also vulnerable were those that were the older adults that were in their houses or in the apartments, and so we were very dependent again on our nonprofit partners who were the service providers, and through that interaction we were able to identify certain apartment buildings where we had to deliver food on an ongoing basis, where we had to get them in touch with some of our health providers. But it was all through those relationships with those providers that we're able to address that and get the information out and get information in. So that's a great question. That was one of the areas that we really focused on here in Denver, older adults and people with disabilities.
I'm going to jump in there too, if I could. In Minneapolis too, I would say similar to Denver, that seniors and people with disabilities was a critical population for us. One of the dialogues that I was talking about actually was one with the senior and the people with disabilities community. It was actually our highest attended workshop, and so with that. A couple of things on that is one of the things that we were hearing a lot was in apartment complexes where seniors were living, that they weren't feeling like they were taking appropriate measures to sanitize. And so the city was taking stepped up efforts in order to make sure that apartment owners understood their responsibility to making sure that they provide as safe of a environment as possible for the residents that were there. So that was a piece that came out of that work as well. There was also a lot of concern around non-English speaking elderly folks and being able to access information. And so we have contracts and partnerships with a number of Black nurse programs in the city. And so really stepping up our information, going out through those channels as well, to making sure that people were receiving information and services that they needed to during that time period as well.
I was just going to add that one of our roles as a regional organization is the coordination of specialized transportation in an 8-county region. And so both public and nonprofit providers of specialized transportation. And so many of those providers are through senior centers. Senior centers in Ohio were shut down. And so, you know, seniors who needed to go to the doctor's offices didn't have the transportation, the transit options that they used to have. I mean, it was just, and so we did a great deal of work with our transit providers on modifications to their vehicles for those who were able to continue operating to provide that specialized transportation. And then the other thing is that, you know, I mentioned before that a lot of our work is built on the World Health Organization, AARP Livable Communities model. They have a great deal of age-friendly work, and they actually published a special piece about communicating with older adults during the pandemic, which was really, really helpful and very good. And the other group that we leaned on a lot was the Frameworks Institute for the way that they recommended some communication methods particularly for providers of services to older adults.
Yeah,
Great, thank you all for your thoughts on that.
With our nonprofit providers that work with our residents with disabilities was also really important to help us address specific needs on a very immediate manner.
Great, thank you all three for the response to that question. This next one is a bit of a two-parter. We have someone who would like to drill down more on community residents' involvement and sort of naming and acting on how you address the pandemic. And then a sort of supplement to that is, what's the residents' role in decision-making in all of this? Is there a time and place for that during the pandemic? And do they have say over things such as how resources are allocated? And the question is in the chat if you need to re-see it.
It's from Valerie.
I'll jump in first, and other folks can jump in as well. So from our standpoint, as I was, you know, we really looked at this as trying to make sure our response was as community centric as possible, and that the community was informing the city's response as much as possible. And as I mentioned, we set up this what's called the Shared Power Advisory Committee, and that was a very specific name because the idea would be that resident leaders would actually be working directly with the city to help to design the city's response. And so it wasn't the city simply going out and trying to do our best guess or our best estimate about a way that we should respond to the community. It was really intended to be driven by a lot of the community residents, community leadership that was out there to help the city and actually being able to mitigate and understand how community was being impacted. The second thing, as I was mentioning around these community dialogues, was really to have the community voice at the center of the conversation. And so they were open to the public, and a lot of folks, just residents, sat in on those. There were community leaders as well that were invited to it, with the idea that, again, hearing directly from the community of what issues were there and what the city needed to do in order, and that we could then understand what we would need to do in order to respond to that. So we are, a lot of this effort was intended to be community driven and community supported, and that's how we took our approach.
Mm-hmm. Yeah, I would say.
I might just quickly, David, I did send you a note. I'm at the Kettering Foundation. I'm fortunate to know both Stacy and Derek very well, but I'm quite impressed with what your community has done in engaging with the residents of your community. So I'd like to follow up with you at some point in time if that would work for you.
That'd be awesome. Thank you.
Yeah, I'm impressed with what Minneapolis has done as well. And I'm glad I made this contact with you, David, because we're in similar roles in our cities. We could exchange some ideas.
Almost everything you said, other than changing the titles on your committees and stuff, sounds almost identical. So.
Oh yeah, and I'll just say, Valerie, to your question that, like David, in our immigrant and refugee community, I mean, the community residents, the contacts that we have, what I would call the community trustees, they aren't necessarily the usual suspects, so to speak. They're the folks that are kind of under the radar, but they're the ones that everybody else goes to for information. Yep. We're really fortunate that we have a good network in that type of area. And so we would get a lot of information from them as far as this is what's happening, this is what we need. And we were able to address that and get that information out, because they were really the not the self-anointed leaders, they were the leaders, of the community, the trusted ones, and we were able to get information out and get supplies out where needed. That was absolutely essential. I mean, we could not have done anything that we did without that type of connection that we had, and it continues to this day. And they were so incredibly helpful to get the information out and get the information in.
I'm gonna, if I could dovetail off of what Derek just said there, because I think that's really critically important. And in our structure here in Minneapolis, the staff that we have that I was referring to that are embedded into community, one of the things they need to do, and as they navigate kind of community space, is understanding the difference between formal and informal leaders. And what Derek is talking about there, the informal leaders, the people that people actually go to for information or trusted information, that's critical. A lot of titles out there, and they may or may not carry any weight. Some of them do, some of them don't. But understanding that landscape is critically important to be effective. So I didn't mean to interrupt. I wanted to kind of dovetail off of that.
That sounds great. And I know Derek well, and Stacy's here in Dayton, where I'm located. So guys, look for an email from me to ask you to repeat your presentation to the Kettering staff. You are just wonderful resources on the ways that you can engage people around issues that they care about and things that are really important to them.
Thank you, Valerie.
Yes, thank you, Valerie, for that great question and follow-up. Glad that we're creating connections. That's what we're all about here at the National Civic League. I'm not seeing any other questions in the chat. I'm going to jump in with one of my own, and something that we've talked about the league about a little bit. And Derek, you talked about this a little bit in your presentation, and I'm just wondering how, as community leaders and dealing with this, you have been able to overcome this particular challenge. And that is the difference in messaging and policies from the local, regional, and state level. And so, like you mentioned, Derek, that Governor Polis didn't have a stay-at-home order until a week after Denver, and that might be confusing to some people. So how did you either coordinate regionally and or communicate differences in policies and stances from the local, regional, or state level?
Yeah, that's a good question. And we were actually pretty fortunate in that there's a good amount of coordination between the governor's office and the city. One of the issues with Denver, was the regional messaging, because Denver is kind of the central part of the metropolitan area, and in any approach that we did, the Mayor Hancock of Denver really had to work regionally with the neighboring municipalities. I mean, there's probably 40 different municipalities in the metropolitan area. And so any approach had to be very well coordinated, and there were regular regional mayors caucus meetings that had to take place. But, and so that coordinating message was one that took place in those meetings with those other metro mayors. The state orders kind of we tried to be as consistent as possible. We would use the state orders as kind of the guiding order that we would go with. And then we would, there were certain tweaks that we might do locally, but it was just constantly messaging and working with our community resident network in order to get that out on a regular basis. As with anything, it could always be done better because you can always communicate more or more effectively. But we just through those different methods was what we put in place in order to try to keep the messaging coordinated.
Thanks, Derek. And curiously, did you guys run into any similar issues either in Minneapolis or in the Dayton region?
I can jump in. I didn't want to jump in first right away again. I think what Derek was saying there, I think our response would be similar. I think a lot of it was around coordination. A lot of it was around communication. Minneapolis often would be taking steps that basically predated or pre-emerged before the governor did. For example, we did the mandatory mask well before the state put that into place. And so it did create some confusion locally, but as far as which order was, what was the directive. So I wasn't in on those level of conversations between the governor's office and the mayor's office. I'm gathering that they were communicating well. We just needed to make sure that we were clear about what was required in Minneapolis and helping to answer people's questions. Surprisingly here, I should say surprisingly, people really followed the mask order even before it became a mask order. And you feel very self-conscious if you walk into a place right now and you don't have a mask on. You're like immediately, oh, I got to get out of here because I'm just, it's not right. And so the culture here was actually really supportive of that particular piece. But I think to a large degree, we were always a couple weeks ahead of when the state actually did something very similar. And again, like Derek was saying, a lot of it was just communicating what was required here.
So we are in an interesting position because we, there's a great deal of difference in the community spread levels in the counties that we serve. And it's not clearly whether it's urban or rural. I mean, it's, there's a rural county around us now that is really, really struggling. And so, but our governor was ahead of the country. I think, Valerie, you can nod with me on that one, that he was really ahead of the country. And I think that the city of Dayton and the Montgomery County were ahead of the state with mask orders. And so I think it's good. I think one of the things that has been interesting, and I give Montgomery County Public Health and the area public health agencies a great deal of credit for this, but I think it's also raised some questions, is they've done a really good job of using census tract mapping to show where there are concentrations of cases. And so that's great for the residents in the communities where the spread is higher to actually have that visual to have it be very, very real. Unfortunately, the flip side of that is that there are areas of our county who think it isn't going to touch them because they're not showing up on the map. So they perhaps don't take the guidance quite as seriously. So I think this pandemic and government's response to it at all levels, local, state, and federal, will be studied for decades to come. There's no doubt about it.
I'm curious as far as ongoing challenges that you're seeing, Stacy and David. I mean, as far as down the road, some of the things that you guys are concerned about as with the recovery or the ongoing addressing of COVID.
I mean, the biggest concern right now for us, because our members are local government jurisdictions, public agencies, is just going to be the devastating blow to their revenue sources.
Oh yeah.
And I know you guys are probably dealing with that, having spent a couple decades in local government. I mean, I don't know. I think this is going to be one of the things that we're feeling the impacts from a budget perspective. Individuals it's going to change for a very long time. Local governments, it's going to change what we do for a very long time. I'm really impressed and really proud of some of the ingenuity that's happening though. So I think it could shape things to be really interesting in the future. And this is not a topic about public engagement. I know that. We run major public engagement opportunities for huge projects like highways and, you know, big road constructions, bridges, like all these massive projects that we really, really push for the public to be highly engaged and give us feedback about. We're doing an 8-county specialized transit plan right now for how this is going to be funded for decades to come in an 8-county area. We've had to shift all of that online. And there are some really creative ways that there's happening. And we're also learning ways that it doesn't work. And I think this forcing people online for public engagement is not a bad thing, but it also really shows where there's a lack of access and that you can't, you know, and so it's an opportunity, and that's the way I'm choosing to look at it.
I would agree. The online piece, it's great that we had that the technology and we can reach a lot of people that way. It's also very limiting for some people, which is, Stacey, the work that you're doing, and we have to be very cognizant of that. To answer your question, budget is one piece. We already had a 15% budget reduction for our city this year, and we had to do a major budget adjustment, which we just finished. We're also anticipating a major budget shortfall again next year. Businesses are closing, all those kind of things that are still going on. And so, those are going to continue. I believe they're going to continue for quite some time yet. A lot of smaller businesses, when this gets into the engagement side and when we get into an equitable piece here and look at equity in this, the businesses that are shutting down it's not an equitable shutdown in essence, the ones that are closing. And so that's going to have some very, very profound impacts on disparities that are already existing. And honestly, regarding COVID itself, just trying to keep people on people's eye on the issue and not get complacent and let this slip out of our hands again. Those are the big issues. I mean, the city will deal with its budget shortfall. I mean, they'll have to, and it's major. I don't want to understate. It is a major, major impact. But I think the bigger issue that's out there from a community perspective is the number of businesses and the people that have businesses that are shutting down.
Right.
So,
I know here, and we're seeing the other corollary impacts from the economy. We're seeing, I think, just psychologically a lot. I'm seeing and sensing a lot of anger and a lot of unhappiness that is going on, and it's manifesting itself in a lot of different ways. And so it's that's one of the things that I'm seeing here in Denver.
Absolutely. Well, this is a very multifaceted problem, and it is affecting us both locally and as a country in a myriad of ways. And I appreciate the three of you joining us to share some of the successes and things that you guys are thinking about in your own communities. I'm glad that the three of you are in the helm in both Denver, Minneapolis, and the Dayton area. And again, thank you for sharing your wisdom.